Hi guys, welcome to this short video on fears and anxieties of the CSA exam. Now, I remember doing this exam myself. I remember the month leading up to it, the week leading up to it. I remember the walk up to the centre. I remember sitting down in the room waiting for my first patient. It's a stressful exam. It's a fear-provoking exam. There's no getting away from that. And whilst we all know that anxiety and fear can have a beneficial effect and a positive effect sometimes, there are some key common fears that people have when it comes to this exam, both in the preparation and also on the actual day itself. So I want to go through some of those common things that tend to crop up again and again at our courses. Now, I'm Arora, I'm a GP and an educator in West Midlands, and I've seen a lot of these things and been through them myself. So hopefully this will be of some value to you in getting a little bit of that confidence back up when you have those days where you're feeling a little bit fearful and a bit frightened. So the first fear that we hear a lot on our courses is the fear of missing the hidden agenda or the nub of the case. So there's various terms thrown around about it. And essentially, some people often look for the key thing that is the defining thing of this case, the big underlying thing that we're supposed to work really hard to find out. And once we get this, the case is sorted, and if we manage that, we'll be fine. Now remember, it doesn't quite work like that. And I remember preparing for this exam myself and really trying to work out in every case, what is the hidden agenda? And I almost had this feeling that if I wasn't getting anything that seemed big enough to fit that mold of what a hidden agenda could be, I started to stress a little bit. Gosh, this is too simple. There must be something. I must be missing something out. And that leads you to do lots of other silly things like asking again and again and again, are you sure there's nothing else that might be going on here? Are you sure there's nothing else that you wanted to ask me? And that just shows lack of confidence. And why? Because we're fearing that the things that we've hopefully done well enough are not good enough and we've missed something out. So remember, don't be looking for this hidden agenda so much. If you do the right questions, and we talk a lot in our other videos about what kind of questions to cover and what things to cover in data gathering, if you're doing those things properly, they're not trying to trick you in this exam. They're looking to see, are you competent to do GP consultations, to carry out GP work in a practice on your own one day. And as long as you're doing the right things and you're getting the right things out, don't worry too much about this subtle hidden thing that is supposed to be really difficult to get out. Do the right things, you'll get the right questions, and you'll know not just the hidden agenda, you'll understand the 2 or 3 issues that might be going on in that scenario, both in the medical terms or in the psychosocial terms or in the patient's mind. Again, things that we cover a lot in our videos, but don't be so focused and fearful of missing that hidden agenda. Sort of the second major fear that we see quite a lot is this fear of running out of time. Now, of course, 10 minutes flies by when you're doing cases in this exam. It does in real life, but even more so when you're under the pressure of the exam and also when you're dealing with lots of different issues sometimes, probably more than we may do in real life sometimes. And we have 2 main worries about time. Number one, that I won't get to the end. I won't be able to sort all this stuff out before the bell goes. And secondly, if I do sort it all out, it's going to be so doctor-centered and so quick and so 100-mile-an-hour type of talking from me that it's going to pull me down from that side as well. So the first thing I say about time is don't worry so much and expect that every single case will finish with you shaking the hand of the patient and then walking out before the bell goes. It doesn't work like that all the time. You might get the odd case where that happens, but if you're doing that each and every time, you're finishing every single case at minute 8, minute 8.5, there's probably a few issues going on that we haven't quite picked up yet in data gathering. So expect some cases, or quite a few cases, where the bell goes and you haven't completed management. But remember, completing management is not all about have I shake the patient's hand and dealt with every single thing going on in this case. That's often impossible. In real life, we don't do that. We see these patients 3, 4, 5 times where we might deal with all these issues in completion. But it's really important that at least by the time that bell goes, you've demonstrated the understanding that you have of all of the various issues in the case. You might not have dealt with them all in completion. You'll of course pick up 2 or 3 maybe clinically relevant or maybe shared management type of approach where you open and expand and deal with them in more detail, but don't think that you have to cover and complete every single issue going on. It's impossible and it doesn't quite work. And the only way you will do it, like I mentioned earlier, is if you talk at 100 miles an hour and not let the patient even breathe. So the other thing we commonly see about time is that people, because of that stress of completing everything in 10 minutes and the want to get everything done before the bell goes, it's that time becomes a major part. So every 2 or 3 seconds, you can see at our courses when we're doing cases, people are flicking down, the eyes are looking down every 5, 10 seconds to look at the time. And you see stress levels increase as time goes on. As you hit minute 4, minute 4.5, minute 5, minute 5.5, you can tell the tension's building up and they're already worrying about how am I going to finish this case in the remaining 2 or 3 minutes. I haven't even examined the patient yet. So remember, firstly, your job is not to have completed every single issue in a management plan. And secondly, don't look at time too much, because like if you look at our management video, you'll realize that even if you have 2.5 minutes left when you start your management plan, that's still enough. As long as you use that 2.5 minutes effectively and wisely, I suppose. It's not all about how much time do you have. You can have 5 minutes of management, but if you're not doing the right things, it's not going to help anyway. So maybe consider looking at the time only once in your case. This is what I did. It won't work for everyone, but this is what I did. So I used to look at the time all the time, and then I decided that, look, I'm only going to look at it once, and the time that I want to look at it is when I'm about to start management. I don't really mind how long it takes me to get data gathering, because I'm going to make sure I do all the right things that I think need to be done. And I'm not worried so much, because some cases are going to take a little bit longer, some cases are going to take a little bit quicker. It depends on what issues are there, and like I said, what emotion the patient is displaying. But the time I look at my clock is when I'm about to start management. I want to know, how long have I got left before this bell goes? Have I got 2.5 minutes where I need to be a little bit smarter and show off my understanding of the case a little bit better, a little bit earlier? Or have I got 4.5 minutes where I can afford to expand a little bit, take things a little bit slower? So for me, I completely changed from going to looking every 2 or 3 seconds, which was stressing me out, into looking once and looking when I'm about to start management, and that's it. Because that gives me a heads up as to how do I go from here, and how quickly do I need to do or how effective do I need to do my next couple of minutes. So if you are someone who worries about time a lot, firstly, don't think you need to accomplish everything by the end of that 10 minutes. It's impossible sometimes. And secondly, try and resist the urge to keep looking at the time. It doesn't go any slower. In fact, it seems like it's going much quicker. And maybe have a couple of intervals or a couple of checkpoints where you look at the time just to kind of gauge yourself and to make things move so a little bit smoother in your own mind. So don't fear time too much. There's a few things you can do to try and make it a little bit less worrying. So the third thing we hear quite a lot when it comes to our courses is this magic formula, and it's the fear of not having the magic formula for the exam. Now, we all know that there is no magic formula to exam, and if there was a magic formula to this exam, there'd also be a magic formula to real life consulting. And you guys know that when you're consulting day to day, each and every scenario, each and every patient, each and every consultation is different, because you're a little bit more relaxed usually, and you're doing things that you do on a day-to-day basis without thinking. However, when this fear kicks in that I need to understand the magic formula in order to pass this exam, then a lot of wasted energy goes into trying working out what this magic formula is. And then it might get a bit frustrating because that formula doesn't work in the next case. And it's slightly different when you try. It might work beautifully in one case, you try it in the next case, and it falls flat on its face. And then you wonder, have I got the right formula? So we've got to get away from this fear of the fear that I don't know the magic formula, and the aim of trying to find this magic formula. There isn't one. Like I said, in real life, you go with the patient. You may have some key things in your mind that you need to cover, or you feel that I must be doing the 2 or 3 of these things just to make sure I'm not missing key points out. That's very different from a formula. A formula is something that I must stick to. I must do the same each and every time, because that will look unnatural, and that will give you the opposite effect of what you're going for. So don't worry about not having a magic formula. Don't go looking for the right approach to this exam. Yes, our previous videos talk a lot about things that you should be thinking about, things that you should be incorporating into data gathering. Slightly different to a formula where you do things one by one as a set structure or a set protocol. Don't worry too much about it. You don't need one. So the fourth thing that we commonly hear about in terms of fears is a fear of going blank in the middle of a case. Now, we're humans, we're going to be stressed on that day, we're anxious on that day. You're going to have somewhere in that 13 cases where your mind goes blank. It'll feel as if you have no idea what question to ask, no idea where you're going. You're going to have that pressure building up, thinking, where do I go now? What's this all about? So expect it. When you expect it, firstly, you can prepare for it. If you just hope that it's not going to happen, then it will probably happen again and again and again. And we all know how quickly things can ravel themselves open in terms of the next case and the next case. So what I often suggest is have on your whiteboard, you've got a pen, so write a couple of things in big letters on that board, some bullet points, a couple of things that can get your mind re-triggered when you go blank. So for example, write the word red flags or write the word ice on there. Just a couple of words, that's all it takes. Your brain will look down, it'll re-trigger itself, you'll start to get going, and the flow will be picked up again. And you're therefore not fearful of going blank because you know it's going to happen, but you also are confident that you've got something in place for when it does happen. So be prepared for that. It will happen at some point, but just have something to re-trigger your brain off and get things moving. It'll work every time. So one of the fifth fears that we often hear talked about a lot is the fear of fatigue. How am I going to get through all 13 cases and be as on the ball as I was at the beginning of the exam in my last 2 or 3 cases? It's a common fear. Now in real life, obviously you get those little breaks here and there. You can go and make a coffee, you can check your email, you might get a couple of cases where actually it doesn't take you very long. They're not as taxing on the mind as you are going to get in the CSA. Because remember in the CSA, all 13 cases are going to require you to think, they're going to require you to work things out, to kind of negotiate things in your mind. So it's very taxing to expect your brain to be on for 3 hours constantly. I know you get a little break in the middle, but it's quite difficult feat for it to do. So no wonder when we do our mock exams, for example, when it gets to cases 10, 11, 12, 13, people's concentration are much lower than they were at the beginning, naturally so. And often it's the first time people are doing 13 cases back to back. And it's very different to when you practice with your colleagues, for example, where you do case, break, breathe, relax, case, break, and it's much easier to flow that way. So suddenly when you throw into this 13 cases back-to-back thing with the pressure of the cases and the sort of depth that some of them go into, it can be quite a challenge. So we talk a lot about giving your brain a little bit of a break between cases. Now I do a lot of meditation training myself, so I'm very aware of how sort of mind works and how you need to give it that break. So maybe this won't work for everyone, but simple things, what we tend to do in this exam is patient comes in, do your 10-minute case, bell goes, and your mind is straight down to the next case. What is it? What could it be? Read it. What could possibly come up? Bell goes again. Patient walks in. 10 minutes. Same process again and again. So your mind is never stopped. It's just on all the time. So what we encourage people to do is take 5 seconds out as the patient walks out the door and just get your mind away from that place. Close your eyes. Think of a color. Think of somewhere else. Just get yourself out of that zone. 5 seconds is all it takes. And then come back, rezone, look at your next case, and you're away. But just that little act of taking yourself away from that stressful situation, even for a few seconds between each case, can help preserve that alertness and preserve that concentration right till the end of the exam. Because it's those last few cases that can make all the difference. 27 marks say those last 3 cases. If you're losing some of those out because of fatigue and concentration problems, then you're doing yourself a disservice. All that work and practice over 2-3 months can go because of that. So have something in place that allows you to keep yourself and your concentration as much as you can right till the end. And little things like those 5 seconds between each case can really make a difference. So as you can see, fears, anxieties, they're normal, they're part and parcel of going through this exam, any exam, I guess. But as you can also see, there are some common themes that emerge and things that you can do to put your confidence, like I said at the beginning, a little bit higher, so you're feeling on the day a little bit more prepared and ready to face the challenges that are going to come. So I hope you found this video of use. There are lots of other videos on our YouTube channel, and they're focusing more on the do's and don'ts in particular areas of the skill set of this exam. So how to do certain questions, how to deal with management, how to deal with difficult cases. So feel free to have a look through those. If you have any other queries or any other videos that you want producing, both for the CSA or for the AKT or any other aspect of GP training, then drop me an email or drop me a tweet. My details should be down below. But if you are taking the exam in the next couple of weeks or months, good luck. I'm sure you'll be great, and I hope to see you again soon.